lot of patients ask me what a total shoulder replacement is. Essentially, at the most basic, it's much like a total knee replacement or a total hip replacement. A lot of people know and understand that. Well, a shoulder replacement is no different. It's a replacement of the shoulder with metal and plastic parts. It's essentially for patients who have severe arthritis in their shoulder. Basically, the cartilage is all worn out and they're bone on bone, and there's really no other options to relieve their pain. So we make an incision in the skin and basically remove the diseased bone and cartilage and replace it with metal and plastic parts. In general, there are two types of shoulder replacements. There's what's called an anatomic total shoulder replacement, which is your basic shoulder replacement, and that's when patients have a lot of arthritis, but their rotator cuff and tendons are still intact. However, in cases, especially in older patients, where the rotator cuff is torn, retracted, atrophied, which means that the muscle is now shrunk and is scarred in, there's no chance to repair the tendon, so we do what's called a reverse total shoulder replacement, where essentially, instead of the ball of the humerus being on this side and the cup on this side, you reverse it and put the ball on the cup side and the cup on the other. And that basically just changes the dynamics in the shoulder that allows the deltoid to now work in place of the rotator cuff. And it's a marvelous operation that really helps people who have lots of pain. With this procedure, both the anatomic total shoulder replacement and the reverse total shoulder replacement, these can be done outpatient or with a 24-hour observation. Obviously, that always depends on the health of the patient in each unique situation.